Irritable bowel syndrome, IBS, is a common gastrointestinal disorder that affects the large intestine. It is a chronic condition that can cause a variety of symptoms, including abdominal pain, bloating, constipation, and diarrhea. IBS affects people of all ages, but it is more common in women than men. The exact cause of IBS is unknown, but it is believed to be a combination of factors, including abnormal muscle contractions in the intestine, inflammation, and changes in the gut microbiome. Stress and certain foods can also trigger symptoms in some people. There are three main types of IBS. IBS with constipation, IBS-C, IBS with diarrhea, IBS-D, and mixed IBS, IBS-M. IBS-C is characterized by infrequent bowel movements and hard stools, while IBS-D is characterized by frequent bowel movements and loose stools. IBS-M involves a combination of both. Diagnosis of IBS is based on the presence of symptoms and ruling out other conditions that may cause similar symptoms. There is no specific test for IBS, but doctors may perform blood tests, stool tests, and imaging tests to rule out other conditions. Treatment for IBS focuses on managing symptoms and improving quality of life. This may include dietary changes, such as avoiding trigger foods and increasing fiber intake, as well as stress management techniques, such as exercise and relaxation techniques. Medications may also be used to manage symptoms, such as antispasmodics for abdominal pain and laxatives for constipation. In conclusion, IBS is a common gastrointestinal disorder that affects the large intestine and can cause a variety of symptoms. While the exact cause is unknown, it is believed to be a combination of factors, including abnormal muscle contractions, inflammation, and changes in the gut microbiome. Treatment focuses on managing symptoms and improving quality of life. Irritable bowel syndrome, IBS, is a common gastrointestinal disorder that affects millions of people worldwide. The exact cause of IBS is not fully understood, but there are several factors that are believed to contribute to its development. One of the main factors that may cause IBS is a problem with the way the muscles in the digestive tract contract and relax. In people with IBS, these muscles may contract too strongly or too weakly, leading to symptoms such as abdominal pain, bloating, and diarrhea or constipation. Another factor that may contribute to the development of IBS is an imbalance in the gut microbiome. The gut microbiome is the collection of bacteria and other microorganisms that live in the digestive tract. When this balance is disrupted, it can lead to inflammation and other digestive problems that may contribute to the development of IBS. Stress and anxiety are also believed to play a role in the development of IBS. Many people with IBS report that their symptoms are triggered or worsened by stressful situations or periods of anxiety. This may be due to the fact that stress can affect the way the digestive system functions, leading to symptoms such as abdominal pain, bloating, and diarrhea or constipation. Dietary factors may also contribute to the development of IBS. Some people with IBS find that certain foods or food groups can trigger their symptoms. Common triggers include dairy products, gluten, and high-fat or spicy foods. Finally, genetics may also play a role in the development of IBS. Studies have shown that people with a family history of IBS are more likely to develop the condition themselves. In conclusion, the exact cause of IBS is not fully understood, but there are several factors that are believed to contribute to its development. problems with the way the muscles in the digestive tract contract and relax, an imbalance in the gut microbiome, stress and anxiety, dietary factors, and genetics. 1. Oats. Oats are a good source of soluble fiber, which can help regulate bowel movements and reduce symptoms of IBS. They also contain antioxidants and anti-inflammatory compounds that can help reduce inflammation in the gut. 2. Ginger. Ginger has been shown to have anti-inflammatory properties and can help reduce nausea and vomiting associated with IBS. It can also help improve digestion and reduce bloating. 3. Peppermint. Peppermint has a relaxing effect on the muscles in the digestive tract, which can help reduce cramping and bloating. It also has anti-inflammatory properties that can help reduce inflammation in the gut. 4. Salmon. Salmon is a good source of omega-3 fatty acids, which can help reduce inflammation in the gut. It also contains protein and other nutrients that can help support overall digestive health. 5. Bananas. Bananas are a good source of soluble fiber, which can help regulate bowel movements and reduce symptoms of IBS. They also contain potassium, which can help regulate fluid balance in the body and reduce bloating. 1. Fried foods. Fried foods are high in fat and can be difficult to digest, leading to discomfort and inflammation in the gut. They can also trigger symptoms like bloating, cramping, and diarrhea. 2. Dairy products. Dairy products contain lactose, which can be difficult to digest for people with IBS. This can lead to symptoms like bloating, gas, and diarrhea. Dairy products can also be high in fat, which can exacerbate symptoms. 3. Caffeine. Caffeine is a stimulant that can irritate the gut and cause symptoms like diarrhea, cramping, and bloating. It can also increase anxiety and stress, which can worsen IBS symptoms. 4. Alcohol. Alcohol can irritate the gut and cause symptoms like bloating, diarrhea, and cramping. It can also disrupt the gut microbiome, which can worsen IBS symptoms. 5. Spicy foods. Spicy foods can irritate the gut and cause symptoms like diarrhea, cramping, and bloating. They can also increase inflammation in the gut, which can worsen IBS symptoms. Irritable Bowel Syndrome, IBS, is a common digestive disorder that affects millions of people worldwide. While the exact cause of IBS is unknown, there are several ways to prevent the onset of this condition. Here are some specific tips to help you prevent IBS. 1. Eat a healthy diet. Eating a healthy, balanced diet is essential for preventing IBS. Avoid foods that are high in fat, sugar, and processed foods. Instead, focus on eating plenty of fruits, vegetables, whole grains, and lean proteins. 2. Stay hydrated. Drinking plenty of water is important for maintaining good digestive health. Aim to drink at least 8 to 10 glasses of water per day. 3. Exercise regularly. regular exercise can help improve digestion and prevent IBS. Aim to get at least 30 minutes of moderate exercise per day, such as walking, jogging, or cycling. 4. Manage stress. Stress can trigger IBS symptoms, so it's important to manage stress levels. Practice relaxation techniques such as deep breathing, meditation, or yoga. 5. Avoid trigger foods. Certain foods can trigger IBS symptoms, so it's important to avoid them. Common trigger foods include dairy products, caffeine, alcohol, and spicy foods. 6. Get enough sleep. Getting enough sleep is important for overall health and can help prevent IBS. Aim to get 7 to 8 hours of sleep per night. 7. Don't smoke. Smoking can irritate the digestive system and increase the risk of IBS. If you smoke, consider quitting. By following these tips, you can help prevent the onset of IBS and maintain good digestive health. If you are experiencing symptoms of IBS, it's important to speak with your healthcare provider for proper diagnosis and treatment. Irritable Bowel Syndrome, IBS, is a common gastrointestinal disorder that affects millions of people worldwide. It is characterized by chronic abdominal pain, bloating, and changes in bowel habits. While there is no cure for IBS, there are several ways to manage its symptoms. Here are some of the most effective ways to cure IBS. 1. Dietary changes. One of the most important ways to cure IBS is to make dietary changes. This includes avoiding trigger foods that can exacerbate symptoms, such as fatty or spicy foods, caffeine, and alcohol. Eating smaller, more frequent meals and increasing fiber intake can also help to alleviate symptoms. 2. Stress management. Stress can exacerbate IBS symptoms, so it is important to find ways to manage stress. This can include practicing relaxation techniques such as meditation, deep breathing, or yoga. 3. Exercise. Regular exercise can help to improve digestion and reduce stress, both of which can help to alleviate IBS symptoms. Aim for at least 30 minutes of moderate exercise per day. 4. Probiotics. Probiotics are beneficial bacteria that can help to improve gut health and alleviate IBS symptoms. They can be found in fermented foods such as yogurt, kefir, and sauerkraut, or taken as a supplement. 5. Medications. There are several medications that can be used to treat IBS symptoms, including antispasmodics, laxatives, and antidepressants. These should only be used under the guidance of a healthcare provider. 6. Alternative therapies. Some people find relief from IBS symptoms through alternative therapies such as acupuncture, hypnotherapy, or herbal remedies. It is important to talk to a healthcare provider before trying any alternative therapies. In conclusion, while there is no cure for IBS, there are several ways to manage its symptoms. By making dietary changes, managing stress, exercising regularly, taking probiotics, using medications as needed, and exploring alternative therapies, many people with IBS are able to find relief from their symptoms. I hope you found this information helpful. consider subscribing and setting notifications for future updates.